I'm back. Hi, this is Yvette from YvetteLaboy.com, and this is my live chat. It is called Breathless Lupus Pleurisy. And I'm a holistic health coach and lifestyle coach and autoimmune expert. I specialize in areas of systemic lupus. I also am a Reiki master, magnified healer. A magnified healer is a person who works with the chakras. I also work with herbal therapies. I'm a public speaker, health educator, and I like to speak about lupus and help people who have lupus because I suffered with lupus for about 16 years of my life, and it took me 2 years to heal my body, and now I'm actually symptoms free. Hey Ross, how are you? Thanks for joining in. And it took me 2 years to heal my body. And I have been, I froze. Okay. So I want to pour my knowledge into you so you can learn how to better manage your illness and heal your body like I did. So today hey sweetie, how are you, Ross? Miss you guys. And congratulations on the new baby. Mwah. Love you. Anyway, today I will share my wisdom with all of you, and I invite you to take a step to learn more about your disease and how you can create a healthier life that is symptom-free. Hi, Michaela. Thank you for joining in, sweetheart. Mwah. Miss you, Ross. So, what is pleurisy? Well, most frequent lung problems that affect people with lupus is called pleuritis, also known as pleurisy. And this is something that I suffered with when I was ill. And this condition, the pleura, a membrane that covers the exterior of the lungs and the interior of the chest cavity, becomes inflamed. And although the pleura normally produces a small amount of fluid to lubricate the space between the chest and the wall and lungs, the lung can build up excessively, liquid, a lot of liquid there, a lot of fluid. So that's called pleural infusion, which happens when the fluid between the lungs and the chest wall leaks out, and it can cause a lot of pain. So pleurisy is a condition involving inflammation, obviously, because so is lupus. Pleurisy usually occurs as a side effect of another illness or ailment. So most people who suffer from pleurisy is because they have some other type of illness. It can be anything from a cold, an autoimmune disease like lupus, or any other autoimmune disease, pneumonia, rheumatic fever. So pleurisy may also be associated with air leaking in the pleural cavity from a punctured lung, a condition called pneumothorax. That's it. That's the name. Excuse me. This may occur after a chest injury involving like a broken rib. It may also be caused by TB or lung infections, as well as a tumor in your pleura. But for this talk, I'm concentrating on lupus and pleurisy. So the inflamed pleura layers, they rub against each other every time the lungs expand to breathe in air. When you do that, there's a rubbing. So this can cause a sharp pain with breathing, shortness of breath, and rapid shallow breathing. For most people with lupus, the problem is that the disease, which causes inflammation throughout the body, which is the lupus, which, as you know, is a connective tissue disease and an autoimmune disease, also inflames the lining around the lungs, and that is called pleurisy. So this inflammation can cause a sharp stabbing pain in the chest. It might even come and go over, it may come and go over time. Now, I suffered with this when my lupus was active, and it was horrible. It was horrible. I had two conditions that the lupus gave me. Well, it did several things, but it gave me pleurisy, and it attacked my heart. And those of you who know me and who've been on my live chats and are past clients know that I had this issue and how I dealt with it. Thank God, knock on wood, it's no longer an issue. But what pleurisy did to me is sometimes I would get this sharp pain out of nowhere. I could just be sitting down, doing nothing, and I would get this sharp pain in my chest, and I couldn't breathe. Like, You see how we breathe like that? We take advantage of that, people who are not ill. I couldn't do that when I had a pleurisy flare-up, because the pain was so sharp. It literally felt like someone was stabbing me with a knife. And it's just horrible. Anybody out there who has this with their lupus, I feel for you, because I went through it, and it is the worst. It would wake me up sometimes at night, and I couldn't breathe. I would be like, and you can't take a deep breath. All you could do is go like that, because it hurts so much. And I would be afraid. They say usually lie on the side where the pain is. I couldn't do that, because every time I did that, I was afraid I was going to die. So I didn't do that. I would sit up and just take small breaths until the flare-up went away. So signs of trouble may include one or more of the following. Let the doctor know if you have any of these signs. Shortness of breath, even if you're just sitting still, like it used to happen to me. Pain in the chest area that seems to happen for no reason. Pain in your lungs when you take a deep breath, like I said. A cough, like a dry cough, nothing coming up. And if your cough brings up blood, rapid shallow breathing, and a thing called cyanosis, and that's blue discoloration of the skin, and that can be caused by a lack of oxygen in the blood, fever and chills, unexplained weight loss, wheezing, the need to breathe fast for no apparent reason. If you get any of these symptoms and you have lupus, I highly recommend you go speak with your doctor and have them give you a test. And I'm going to explain to you what sort of test they give you for this soon, in a few seconds, in a couple of minutes. But it surprises many people to learn that lung issues are common among people with lupus. But I tell you something, according to the Johns Hopkins Lupus Center, about 50% of people with lupus will experience lung issues during the course of their disease. In fact, lung complications in people who have lupus rank just behind problems with the joints and the skin, which seem to be one of the two top problems people have with lupus, and blood cell counts. And right after that is problems with your lungs, pleurisy. So the more severe the lupus you have, the more likely you are to have lung problems. So physicians typically diagnose pleurisy by taking a medical history, asking the patient about his or her symptoms, and listening to the patient's lungs. So abnormal sounds caused by the inflamed pleura rubbing together may be a sign that the person has pleurisy. And other tests that they use to diagnose is blood tests, obviously, a chest x-ray, a CT scan, ultrasound of the chest, and thoracentesis, which is a procedure which fluid is removed from the pleura with a needle and is tested. And yes, it hurts. Unless the doctor numbs it, it won't hurt. So some of the medications that the doctor will give you for the pleurisy is ibuprofen, and that's an anti-inflammatory medication. You know, that's like Advil, Motrin, that's all like ibuprofen. But they give you other anti-inflammatories. If you have it really severe, then they'll give you prescribed anti-inflammatories for it. And the anti-inflammatory will give you relief by inhibiting the production of prostaglandins, which promote inflammation. There's also herbal therapies as well. And many herbal medicines, although they do not work as fast and powerful as the pharmaceuticals, may help to reduce the amount of anti-inflammatory medication you are prescribed by doctors for this serious condition. And I tell you folks, if you don't take care of it, it's just going to get worse. Believe me, I lived through it. It hurts like hell. It really, really does. Anyway, natural remedies for pleurisy would include antioxidants such as vitamin C and zinc. Immune herbs such as echinacea, olive leaf, astragalus, elecampane, reishi mushrooms, which are really great, chickweed, licorice, and I'm not talking about Twizzlers, because sometimes when I say licorice to my patients, to my clients, they're like, What do you mean? You want me to eat Twizzlers? No, I don't want you to eat Twizzlers. Licorice is a herbal therapy. Elder, golden seal, and garlic are all good natural remedies for pleurisy that if you add it with your medications, it does help. Others are other anti-inflammatory herbs such as frankincense. Frankincense is awesome. Frankincense, it's really great. I have a lot of my clients that started using it, and it really has helped them with the inflammation, with the pain and discomfort, and because it reduces the inflammation. Not that frankincense is a painkiller, because it's not. It's an anti-inflammatory. Another one is Eucommia. What I would do is check that one. It's spelled Eucommia. Check PubMed. There's a lot of information about this anti-inflammatory herb and its effectiveness on lupus. Another good one is ginger, chamomile, Japanese knotweed, turmeric, which you all know. That's a great anti-inflammatory. And white willow bark. What I want to say about white willow bark is if you are on aspirin therapy or are allergic to aspirin, do not take white willow bark because it contains salicylic acid, which is also found in aspirin. And another good herb is feverfew. So herbs which help promote lung function may be benefit to strengthen the lungs and improve recovery time, such as campaign, which I mentioned before, licorice, again, not Twizzlers, not the candy, but the herb, and white horehound. That's a funny name, right? Horehound. Anyway, it's effective. It's an effective herb if you have pleurisy. Also, I would say check with your medical practitioner to make sure your medications don't interact with the herbs. Also, go see a traditional Chinese medicine doctor, folks. They can assist you in getting the right dosage of the herb therapy. And if you don't know where to find one, because I had a little challenge trying to find one, even though I'm in New York City, because I wanted to find a good one. What I would recommend is you can start by going to the National Certification Commission of Acupuncture and Oriental Medicine website, which is, write this down, www.N as in Nancy, C as in cow, C as in Charlie, A as in apple, O as in October, my favorite month, M as in Mary.org. They maintain a database of nationally certified practitioners, and I would recommend that you look for someone who is skilled in the range of traditional Chinese medicine therapies, not just acupuncture, okay? Because you want someone who knows how to work with the herbal therapies as well, okay? So things you can do to help you with the pleurisy. One is try a lung cleanse. A traditional Chinese medicine practitioner, TMC, I'm going to say from here on, can help with that. Also, you need to relieve the pressure in the lungs, then get rid of the mucus in the lungs. Also, do a chemical cleanse and a kidney cleanse. Also, stay away from smokers. Secondhand smoke is awful for someone who has pleurisy. It really, really is. It just adds to the issue. So if you're around people who smoke, get the hell away from them. You don't need them around you. Okay? And I don't understand how in this day and age, people are still smoking. There's so much information and research done that smoking is bad for you, and people are still smoking. I don't get that. I don't understand that. Anyway, hi, Michelle. Mwah! Michelle, love you. I miss you so much, my beautiful friend. When the spring comes, we got to go hiking. I am dying to go hiking. Thank you for joining in. Hi, Devin. Hi, Nilda. Thank you all for joining in. Anyway, there are additional ways to ease and treat the symptoms of pleurisy. Several lifestyle changes may also help relieve symptoms of the illness. For example, like I said before, if you lay on the side that experiences pain, it may help lessen the pain. You can take over-the-counter medications, like I said before, such as ibuprofen to help ease the pain and the inflammation, or your doctor can give you something stronger. And try to get as much rest as possible, and don't overdo it when the symptoms begin to diminish. I know I'm guilty of this. If I feel sick and I start feeling better, automatically I think, oh, I'm superwoman. Let me go hiking. Let me go jogging. Let me go to the gym. Let me do this and that. Don't do that. Chill. Relax. Feel better 100% before you go out there and start getting active again, okay? Because you don't want to feel this. Because I made that mistake one time when my lupus was active and I had the pleurisy. I started feeling better and I started going out and I was in the city and all of a sudden in the middle of the street I got this sharp pain. I couldn't even walk. I just froze there. And what I noticed for me, and it may not be the same for other people who have lupus, I noticed that in the winter my symptoms got worse than they did in the summer, but everybody is different. A lot of my clients tend to feel worse in the summer. I was the opposite when my illness was active, and as you know, I'm no longer active. They no longer find the illness in my system. Thank God. Knock on wood. Knock on wood. Anyway, proper rest, fresh air, and sunshine. I'm not saying go to the beach, because if you have lupus, you're not supposed to be going to the beach. What I'm talking about is get out there when it's a sunny day, breathe the air, get into nature, okay? I'm a big nature girl. Avoid getting colds, as this may further deplete your energy. It may deplete the energy reserves and slow down the healing process, and you don't want to do that. So here's some questions you should be asking your MD. Number one, what prescription medication or over-the-counter meds are available to help you in recovery and healing of your condition? And what are the side effects of those medications if long-term use is needed? So you want to ask them that. Also, number two, if possible, can they drain the fluid along with prescription medication to treat and cure the inflammation of the pleurisy, to possibly help your condition get better? And also, you want to also ask, what herbal therapies can you incorporate to help ease symptoms and promote healing of the pleura, along with what you're doing already? And I gave you some really great examples of what anti-inflammatory herbs work with that condition. But, you know, you should always check with your doctor if you are working with an MD for this condition. And like I said, I highly recommend you go see a TCM, which is a traditional Chinese medical doctor who can help you with this. It's very effective. I saw one. I work with one. I also did some Ayurvedic medicine. Highly effective. And you don't get those side effects you do from the medication. Not that I'm saying not to go see a doctor, because I think doctors are very effective and they do help with the conditions. Okay? Just throwing that out there. I don't want anybody attacking me. Because I said that one time and all these people are like, what are you talking about? Are you crazy? So I'm not saying that at all, so don't misunderstand me. So diet tips for pleurisy. I'm going to tell you what not to eat first, okay? Foods that contribute to inflammation are generally considered bad for our health, obviously, including soda, refined carbohydrates, as well as red meat and processed meats. So these foods have been associated with increased risks for chronic diseases. Unhealthy foods also contribute to weight gain, which in itself is a risk factor for inflammation. Yet in several studies, even after researchers took obesity into account, the link between foods and inflammation still remains. So it has nothing to do with you being heavy or thin or anything like that. If you're eating crap, guess what? You're going to feel like crap. And it's going to create certain conditions in your body. When I was sick, I ate crappy. I ate McDonald's. I used to eat Snickers bars at 8 a.m. No wonder I was sick, you know? Once I cleaned everything up, I got better. Of course, there was more to it than that. And I'm creating a lupus group program, which should be launching early spring, late spring, because I'm still working on it. And I have some really amazing speakers that are going to join me. God is good, because God really hooked me up this time with some really great people who are going to join me on this program. And if you want to learn more about that, go on my website, YvetteLaboy.com, sign up for my newsletter, and I speak about that. You know, I'll be telling you when it's going to start and what it's all about, okay? But I'm not going to get into that now. Just want to throw that out there. Anyway, you want to reduce acidic foods from your diet, such as, like I said before, red meat, sugar. Sugar is horrible. It causes inflammation. Dairy products, okay, causes inflammation. And if you guys are on my Facebook page, you saw that that video I put up of the doctor speaking about dairy products. You know, milk is made for baby calves. That's it. It's baby calf food. But people drink it, and they wonder why they get sick. It causes mucus, and if you have pleurisy, you don't want that extra mucus in your chest. Wheat, alcohol, caffeine tea, caffeinated tea, coffee, preserved and processed foods, all these are not good for you. These foods put further strain on your immune system and contribute to inflammation of the digestive function. Also, hey Donald, welcome. Welcome, my friend. Improve your diet by reducing acidic and inflammatory foods that I just mentioned before. I just mentioned it because these foods all place a burden on the liver and digestive system and contribute to the suppression of immunity. And as you know, lupus is a disease of inflammation. So let's not add more to it. Don't add fuel to the fire, folks. Also, avoid saturated fats, trans fat oils. Use olive oil instead. Consume fewer carbohydrates such as white bread, white flour, French fries. All that is crap. Crap, 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 crap. Do not eat it. So now foods that fight inflammation. Olive oil, coconut oil, green leafy vegetables. What did I say? Leafy? Green leafy vegetables such as spinach, kale, and collards. Nuts like almonds and walnuts. I love walnuts. Walnuts are a great brain food. Almonds, I'll tell you about almonds. A lot of people who have lupus have problems digesting almonds. If you're an almond lover and you have an autoimmune disease, what I would recommend is that you soak the almonds first, then consume them. And that should help you to be able to digest them better because, as you know, a lot of people with autoimmune disease, and I know people who have lupus, a lot of them tend to have problems with their digestive system. And I did a live chat about that. You can go on my YouTube page and you could listen in about that. I'm going to be speaking extensively about digestive health on my lupus program. Also, oily fish like the salmon, mackerel, tuna, sardines, all of these have omega-3 fatty acids on them. They are great for inflammation. Fruits like the blueberries, cherries, orange, strawberries, all the berries, they're all anti-inflammatory, and they're all very good. They have antioxidant in them. So an anti-inflammatory diet works well with people who are suffering from lupus pleurisy. Also look into the autoimmune protocol diet. I have two YouTube videos. And they're both on my YouTube page, which is Yvette LeBoy Inspired Wellness. I will post the links underneath this live chat once I'm done in the comments section. And then I have to go over to Instagram because I'm doing the same talk on Instagram. So, fruits and vegetables such as blueberries, like I said before, apples, the leafy greens are high in natural antioxidants, and they have protective compounds found in the plants. That are found in plants, and that's good for us. It's good for our system. It's good for the immune system. It's just all around great for us. And it's great to combat inflammation. Also, replenish depleted nutrients and proteins by concentrating on a healthy alkalizing diet, which includes plenty of the foods that I mentioned before. Also, quality protein, herbal teas, lemon juice. You could do the lemon water or add lemon juice to your salad. Don't take the lemon juice straight like that. If you do the lemon water, only do it for a season. Don't do it all year round, okay? Because it can cause you problems, especially if you have digestive issues. Donald, yes, I'm looking to pick up working with you again. Getting back together and doing the work with us, because I know I can help you, dude. I know I can help you. Anyway, what I was saying, like I mentioned before, you need the protein, quality protein, the herbal teas, garlic, onion, vegetable juices, ginger, turmeric, and good filtered water. I tell all my clients to drink water, and anyone who's worked with me, Michaela, if you're still on, I shove that down your throat. Drink water, drink water. Good filtered water you need, honey, okay? Because it increases cleansing, and you want to eat cleansing foods, vitalizing foods. You want to eat homemade soups and broths. Today, I'm actually making bone broth. And bone broth is great for your digestive system. It warms the body and it has collagen in it. Very good for you. I'm making some of that today. You want to do vegetable juices, nuts and seeds, no peanuts, because people who have lupus tend to have issues with peanuts. Flaxseed oil. You want the quality organic protein, folks. So try to get that at least. I know that some of the organic food is expensive, but try to get as much organic into your life as you can. Also get adequate hydration, like I was saying before, at least 2 liters of water daily. Fluids are especially beneficial for inflammation of pleurisy because liquids keep your air passages moist and it gets rid of germs and irritants. Hi, Primo. My cousin Mandy is on. Love you, Armando. Also, instead of using sugar in your tea, what I would say is add manuka honey and to your herbal teas and to any drinks that you have instead of sugar. So in a nutshell, manuka honey helps reduce inflammation and it has antibacterial components in it. So many problems of the pleurisy and that are caused by lupus in your lungs can be controlled or stopped if you know the danger signs and you act quickly. So it's very important that you get in tune with your body. Okay, folks, it's very important. And I teach a lot of my clients how to get in tune with your body because it's very important. Your body will give you signals. It'll tell you things. And if you know how to read those signals, then you know what you have to do. I want to recommend some books to you folks. I highly recommend the Autoimmune Protocol Diet, an anti-inflammatory diet for people who have lupus and are suffering from pleurisy. There are several books. I'm going to read 3 of them. One is the Lupus Recovery Diet by Jill Harrington. Jill Harrington is a nurse, and she did exactly what I did. She cured her body. She healed her body from lupus. Another good book is called Goodbye Lupus by Brooke Goldner. She's also an MD. She also healed her body from lupus, just like I did. So see, folks, I'm not the only one. Healing is possible. Also, the Autoimmune System Recovery Plan, and that's by Susan Bloom, who's also a doctor, and there's a foreword there by Mark Hyman. He was in that movie Fed Up, and Mark Hyman was actually somebody that I trained with when I went to nutrition school. I trained with him live. Amazing. I learned a wealth of information from him. He really poured his wisdom into me and all the other students. Anyway, those are the books I recommend. You can get them on Amazon. You can check eBay if you want a discount on them. But if you want them brand new, check on Amazon. And you could probably find all of those. I'm not getting a kickback from any of these books or any of these authors. As you know, I'm writing my own lupus book. But I wanted to recommend something to you guys that you can have as guidance that you could look into that may, that can help you out. Anyway, this is all I have to share for today, folks. If there is a lupus related topic you want me to speak about, you can let me know here. Hey, Gerard, how are you? You got to check out Gerard, folks. He created this amazing vitamins and protein shakes that are awesome. You need to get on his website and check them out. They're really great. They're all natural and they're just really amazing for you. What was I saying? I got thrown off. Okay, this is all I have to say for today. If you have any lupus-related topic questions that you want me to speak about, you can email me at inspiredwellness@yahoo.com. You can follow me on social media right here on Facebook. I'm Yvette LaBoy Coach, or From Lupus to Living. Also on my YouTube page, I'm Inspired Wellness Yvette LaBoy. Twitter, Holistic Gal. Instagram, One Holistic Diva. That's right, because I am a holistic diva, baby. Oh, God. I'm nuts sometimes. Anyway, you can visit me on my website, which is YvetteLaBoy.com. I am extremely passionate about speaking about lupus, about being a lupus advocate, and helping people out there who have lupus create a healthier and a better life. I did it. You can do it, okay? Don't doubt yourself. You have the power within you to heal your life, all right? So this is Yvette LaBoy from YvetteLaBoy.com. At YvetteLaBoy.com. We inspire people to get healthy and transform their lives because we want you. That's right, baby. We want you to become the fabulous diva and divo you were born to be. See you at my next chat, which will be next week. Mwah. Love you all. God bless. Thank you for being here with me today. I look forward to seeing you again. Bye.